and well-being. We'd like to also join you to have your questions prepared in line with the discussions. We trust to make it really practical and very insightful. So we will be handling all of those questions and concerns at the end of our facilitator's presentation. So we will be able to engage on the concerns and questions that will come out of this discussion. I want to urge us to, even as we work, let's give it some attention. It's going to be beneficial to us all. Thank you once again. Thank you everyone on this call. Would like to have right away PT Chinecherem Chimaobi Ezema, our team lead physiotherapy, just come up and begin to engage us on the session. Thank you very much. Thank you, PT.
Mr. Good morning, everyone. Yes,
Mr. Chimaobi.
Yes, can you hear me?
Mr. Chimaobi, are you here?
Yes, can you hear me?
Yes, we can.
Mr. Chimaobi, are you here?
Yes, I'm here. Can you hear me?
Oh, great. I see. Okay, so we're good to begin. Do well to prepare your questions, and also let's engage our facilitator so we can have a more impactful session this morning. Thank you very much.
Okay. Good morning, everyone. In celebration of World Physiotherapy Day with the theme low back pain, today we'll be looking into a condition that affects millions of people worldwide. And a good understanding of this very condition will help us in a best strategy to manage it anytime and anywhere we found ourselves. The global epidemics of low back pain is escalating. And it will interest you to know that a staggering 619 million people worldwide suffers from low back pain in 2020, and nearly 10% of world population. So this is one of the reasons why the World Confederation of Physiotherapists have reserved this year's theme in recognition of the work done by physiotherapists to look into this very condition, this global epidemic that is growing as a burden to humanity. So on this note, we are looking into the following as our outline while discussing this very topic. Our learning objectives, we'll be looking into the introduction for the low back pain, the epidemics and types that are available, the causes of low back pain, the risk factors associated with this low back pain, the signs and symptoms, while we look extensively into the diagnosis, then the role of physiotherapy, while we take away the lessons that we are going to embrace as we progress. As earlier mentioned, in addition to what our panel have already said, we are going to look at the causes of low back pain as our learning objective, the strategy for self-care. We also have a good understanding of the impact of our daily activities on our back in conjunction to the role of physiotherapy in managing this very condition. So as we progress, we are open to discussion, we are open to questions, and we are open to interactive section that will give everybody a good understanding of what low back pain is all about. By introduction, low back pain is the region of the spine that connects our pelvis to the upper back. It bears the weight of our upper body. And this very structure, any pain that occurs between the lower edge of the ribs, that's the rib cage, down to the gluteal region, and sometimes radiating to the thighs and even to the lower limbs, that's the feet, is what we call low back pain. It comes in various manner. It's present locally. It can radiate down, and it can also refer pain by shooting down to the lower limbs. A glance at the picture on the slide will give you an appreciation of what happens between the rib cage and the pelvis. Pain that occur within this lower part of the back is what we call low back pain. It is localized in the sense that it can revolve just around the pelvis, around the tailbone, and regionally to the buttocks. When this very low back pain comes in a different shape, in a different manner, it can lead to radiation. Pain will be radiating down to the thigh, down to the calf, and the symptom can come in different presentation, which we are going to look at as we progress. Some of this low back pain also comes in form of referred pain, and it will interest you to know that most times the back may not entirely be implicated. Rather, the nerve that is coming from the spine will be where the pain emanates from. Low back pain ranges from aching pain to stabbing, very sharp, or pain that radiates down to the lower limbs. If you're experiencing this type of pain when you bend, twist your back, or you are lifting, these are signs that you are having a low back pain. And often, most times, it is worse by movement or exertion. When you're coughing, when you are trying to perform an activity that involves you to bring out yourself, or you are sitting or walking, and even standing. These are signs, these are evidence that low back pain is disturbing your spine. And a glance at this picture at the slide, you will understand that the spine is made up of the cervical region, that is the curvature that holds the neck. We talk about the thoracic curve, that's the part that is located at the ribs. And then the lower back, that is where lies the lumbar curvature. The spine itself have an S shape. As one is growing, it will be aligning in respect to our body structure. A global picture of low back pain and the epidemiology shows that low back pain is the leading cause of disability worldwide. Here we mean that a lot of people are being challenged, are not productive, are not functional in the society because of this leading cause of disability called low back pain. 10% of the population in the world as of 2020, that's around 619 million people, experience low back pain. What this means is that 1 in 13 persons suffers from low back pain. It's the leading healthcare condition that contributes to rehabilitation in 134 out of 204 countries that were analyzed. After this analysis, it shows that it's the leading healthcare condition and is contributing to rehabilitation. And looking at what is evident in our country, Nigeria, low back pain is largely occupational based. Population that fall into this group are more of working class group of people or age group related, that is the elderly and the adults. In Lilly Hospital, it is estimated that over 60% of patients experience low back pain. Most patients coming to seek for health assistance at Lily Hospital always come up with this complaint of pain that is either radiating or is shooting down or revolving around their glutes. More women than men suffer from low back pain. And in the course of our presentation, we are going to understand the reason why more women than men have this challenge with a ratio of 1:1.5. A high prevalence among workers. If you look at the global picture, the majority of people that suffers from low back pain are workers. And that can be linked to a lot of factors which we are going to look into when we progress. There are a lot of different types of low back pain, and 90% of low back pain is non-specific. There is nothing clinically to hold on to. And that is because of the spine houses a lot of structure, both the bone, both the muscles, both the tendon, both the ligament, and the nerve that is coming out from their roots. So most occasions, the cause of low back pain is non-specific. So when we look at the types of low back pain or the classes of low back pain, one is a specific low back pain. When you are presenting for a medical assistance, one of the things we are looking out for is to know the type of low back pain you are having. It can be specific when there is fracture. For instance, there is a trauma, there is a fall that led to the bone, one of the bones of the spine, being noted to have broken. This can be a specific low back pain. It will initiate pain. Another part can be as a result of infection. This can come in various ways as a result of the nature of the spine. Another specific type of low back pain that can come in form of tumor, and this is because spine is a common location for metastatic tumors. It's a place where an abnormal growth can start. And when this starts, it interferes with a lot of structures that are around the spine. Another very one is called equina syndrome. This is another specific type of low back pain that manifests in different manner, and it calls for medical emergency. That is specific low back pain. But in non-specific low back pain, which accounts for about 90% of cases, is one that can be managed conservatively. And this type of low back pain may require an X-ray or may not require, but needs a conservative management for it to be addressed. Another class of low back pain is a radicular pain. This radicular pain are most of the time either structural, mechanical, or even as a result of stress. And one of the types of this radicular pain can come in form of sciatica. There is a nerve that runs down the spine. It's the longest nerve that comes out from the lumbar region, that's the lower part of our body, of the back, and runs down to the feet. And this very nerve can be trapped in between this distance that it covers. And when this happens, it comes in form of medical condition that we call sciatica. Then another one that is also leading to radicular pain is spinal stenosis. It's more in older group of people. And in the young, it can be acquired. Here, the spinal canal becomes narrow, such that the spinal cord itself becomes impinged, and it can lead to a lot of individuals finding it difficult to cover a long distance. When they walk for a distance about 6 meters or 3 meters away, they start feeling severe pain that makes it uncomfortable for them, that they start looking for a place to lay the body and the rest. Then in case of radiculopathy, This is another class or type of low back pain that involves the nerve coming out from the spine. When we look at the causes, you'll be able to see the good anatomical structure of the back. You'll be able to understand how the nerves are coming out from their roots and how it can be trapped that can lead to pain called low back pain. In the causes of low back pain can be caused mechanically or non-mechanical. An understanding of the back, this is an anatomy of our spine. You can see how each vertebral body is sitting on top of each other with a disc that cushions it and prevents it from rubbing against each other. This disc also gives room for a nerve that you can see that is coming out from the roots to come out, and the spinal cord to pass through the own canal. This is the normal alignment of our body internally. Then on the outer part, that's where you now come to see the ligaments, you see the muscles, you see the tendon winding to give this spine a good stability. You can see where the cervical spine for the neck started, the thoracic spine covering around the rib cage, and then down to the lower part of our body that is referred to as the lumbar vertebra. And that's where majority of movement, bending, twisting is taking place. And all these structures that helps to stabilize this spine, if put under stress or mechanically troubled, can lead to pain. And some of these muscles that wind around this structure, they play various roles in making sure that we perform our daily activities. Most causes of low back pain arise as a result of muscle strain. As a result of overexertion, injuries, muscle spasm, or sudden awkward movement that can happen. If you look at our structure, the anatomy of the body, you'll be able to see the tendons, the ligaments, the muscles winding around to stabilize this spine. And over time, they are stressed. And this can lead to low back pain. There are other risk factors that can cause low back pain, such as posture, stroke, ergonomics, unhealthy lifestyle, heavy lifting, or a general lack of movement. You can see how the structure of the spine goes. Any stress or factor that can lead to misalignment of these structures will bring about pain. And most times they are implicated by these risk factors, such as posture and abnormal ergonomics, that brings about low back pain. In rare cases, there are other conditions that are not mechanical, but they are rare. Cases like cancer or infection of the spine. You can have a spinal epidural abscesses or even the osteoporotic nature of the spine. These are rare conditions that can cause low back pain. Medically, you can see that there are causes of low back pain when presented to the hospital for holistic examination. It can come in form of sciatica, bulging or ruptured disc, scoliosis, spinal stenosis, arthritis, which sometimes we call lumbar spondylosis, and osteoporosis. These are the medical conditions that impact on our spine and leads to low back pain. You can see how the normal alignment of this spine, when the disc is normal, degenerative changes can cause a severe challenge on the low back pain. That can lead to the disc bulging, that can lead to the disc herniation and thinning of the disc, and osteophytes will start forming and the disc will start degenerating. And when this osteophyte starts forming, arthritis sets in at the low back, which makes it very difficult for us to perform our daily activity. It becomes stiff And this is more in the elderly, although it can be acquired in the young adults. So these are the causes of low back pain, and a risk factor that is very, very implicative to the low back pain are what I would like us to look into. Age is inevitable. Every day we are adding to our days, we are adding to our years, and inevitably is what no one can turn around the biological clock. This is because as we are growing, as we are aging, we are involved in a lot of activities, such as bending, such as sitting, such as running, such as walking. And as we grow old, changes will start taking place in our back, at our back. And this is one of the risk factors. Our fitness level have a role to play. How functional you are in the society, how active you are, is also a risk factor if not properly checked. There are other group of people that are at risk of having low back pain, and that are pregnant women. Pregnant women are those people that have baby, and as a result of this additional weight, the structure of the spine is distorted to accommodate the baby, and this can put a lot of strain or stress on the spine, thereby stretching the muscles, stretching the ligaments, and after delivery, it becomes a turnover for such women to come back to their normal state, and this can provoke low back pain to start. Weight gain. A lot of people have a high body mass index. The normal range is between 18 to 24. BMI, the normal range. And those who are overweight, who are obese at stage 1, stage 2, stage 3 are in trouble because they are putting a lot of load on the spine, which carries the weight of the upper body. And as a result of this additional load, the ligaments, the structures surrounding the spine are in trouble, and this can lead to low back pain. Genetically, a lot of people have, from family background, have a nature that's either they are obese, the mesomorph, and the nature of activity, the nature of the trait they have can also lead to and provoke a low back pain, depending on the environment where they found themselves. Occupational risk, the type of work we do has a role in implicating and causing one to develop low back pain. If the nature of your work involves you to be bending, sitting for a prolonged time, standing, if you are in the force, or you are a desk-bound staff, you are at a risk of developing low back pain. Mentally, in our heads, a lot of people are psychologically in trouble. Pain can emanate as a result of the mental stress we have introduced to our body, and the spine is not left out because our daily activity is narrowed down to how healthy our spine is. Also, our juvenile generation, the children that goes to school or are coming back from school, because of overload, they carry a lot of heavy bag that can give them an abnormal posture, thereby putting strain and stress on the low back pain. And when this starts happening, it can provoke low back pain, thus leading to development of low back pain later on in life. There are other underlying conditions that can cause low back pain, which I have earlier mentioned, like systemic challenges, referral pain, like kidney issues. They can refer pain at the low back as a result of innervation, the dermatome nature of supply on these organs. It can refer pain at the low back. So when you have a kidney challenge, you are at risk of developing low back pain. Posture has been implicated as one of the major factors that can cause low back pain. We are in digital world. We are in technological environment where we make use of various gadgets for our daily living. We make use of tech for phone. We make use of laptop. We have televisions. We have cushion at home. We have different types of mattress that we use. And this can cause low back pain if not properly arranged. It can put a lot of tension, a lot of stress on the spine, thereby causing low back pain. The way we lie down can be in a soldier style, in a starfish position, or free fallers posture. This, if not properly handled, can cause low back pain. I can tell you that one of the major factors for low back pain is posture, and you have to put it into consideration for your daily living. This is a picture of individual performing their duty. This young man, you can look at the posture. You can look ergonomically that his workstation is not well arranged. The distance between the chair and his back, there is no rest for the spine. The legs are not at 90 degrees. And this posture is enough to put tension, to put stress on the lower back. And this can lead to about poor productivity in this work environment. An individual who bends often to collect blood sample or even to put a patient on IV line, if you perform this very role for a long time, you are at high risk of getting low back pain. So it's ideal that your working environment should be ergonomically arranged such that you will not be open to this risk of developing low back pain. Posturally, the way we stand, a lot of people don't put into consideration good standing posture. To stand upright, making sure that the center of gravity divides the body into two halves. Poor posture can provoke back pain because the normal alignment of the spine is in trouble. It can lead to a swayed back or having a flat back can provoke this nature. Then the way we sit in our work environment, the type of chair we use, the type of table we use, and even most times, it's not that the workstation is not properly arranged. It is well arranged, but consciously or unconsciously, we fail to observe normal posture, good posture that should be practical in our working environment. We rather prefer a posture that is comfort for ourselves without putting into consideration the structures that is being strained. Our lying position have also been implicated. Either you're lying sideways or you're lying facing up. But in all situations, any posture you have to embrace, you have to properly arrange for it. You have to have a pillow that will cushion your neck. You have to have a pillow that will cushion your spine. The position that is comfort or that is convenient for you have to be put into consideration. Putting the normal alignment of spine in check will go a long way to prevent you from being at a high risk of developing low back pain. Another factor I've earlier mentioned is obesity. It's a major risk factor for low back pain. We have truncal obesity, we have pear-shaped obesity. A picture we are having at the slide is a pear-shaped obesity, an ample-shaped obesity where you see a lot of fats being accumulated in the stomach. And this can put a lot of stress, a lot of force on the spine, thereby causing low back pain. Aside from even low back pain, obesity generally is a healthcare condition that needs to be checked because it can lead to other factors such as stroke. It can lead to other factors that can even cardiac issues. So it's ideal that we check our weight. it's ideal that we put into consideration the type of meal, the type of food we take to ensure that we stay within the normal range of BMI. In the signs and symptoms of low back pain, there are common symptoms which I would like you to look into or to be looking out for to know whether you are currently having a low back pain or not. When you're having an aching or dull or stabbing pain in the lower back, and its onset is acute, it just started suddenly, after some weeks, it will disappear, it will appear again, it will disappear or appear. This is an evidence that you are having signs and symptoms of low back pain. Or you're having trouble bending or twisting your back, or there's a tingling or numbness or weakness of the limbs, is a sign that something is going on at your back. Most times it's not where you feel this pain that is coming from. Rather, it is at this location between the rib cage and the pelvis. That's where the main cause is coming from. And this pain can travel down to the buttocks, it can go down to the leg and the feet. And it's worse after prolonged sitting. Sometimes it feels like an electric current running down our legs. Our foot is asleep all the time and the pain keeps waking up, keeps waking you up over the night. And some of this may sound familiar to you. And these are indications that either there is a nerve impingement, there is a nerve irritation, commonly known as sciatica, taking place at your lower back. So these are signs that you have a low back pain. This pain also that you feel better when changing position. You're having pain, but when you change position, say for instance, you have been sitting and the pain starts accumulating and you stand up to move around. After moving around, you feel better. This is a sign that you are developing low back pain. And what's after waking up and better after moving around? This is more of arthritis at the back. When you are sitting, when you are lying down, you feel better. When you woke up, you notice that this pain is everywhere, is becoming stiff. But when you start moving around, it starts giving way. These are signs of arthritis at the back and is a result of low back pain. We have muscle spasm and tightness in the lower back and pelvis and hips. When you are experiencing this tightness, that you are finding it difficult to twist, you are finding it difficult to bend around this region. These are evidence of low back pain. You are having difficulty standing up straight, walking, or going from standing to sitting, or covering a long distance, or you are finding it difficult to stand for up to an hour. These are signs of low back pain, and it can be in form of a bulge disc that is coming out from this lower back and can bring about nerve irritation. And you can see some spots where you can feel this pain. Most times, it's not this region where you are feeling this pain that the pain is coming from. Rather, it is from the lower back. Another area of interest I want to and look out for are these signs of medical emergency. Low back pain comes in various manner, it comes in various shape, and it is an advice I'm giving that onset of pain in a person aged over 50 years or under 20 years that is abnormal, that is not normal, that is unusual, it calls for medical emergency. Or you're having a pain that remains when you're lying down, nighttime pain is disturbing you from sleep. On a normal, if you're having a low back pain at rest, you will feel much better. But if after lying down, after resting, even taking away time to rest, and yet this pain is troublesome, it calls for medical emergency. Or you're experiencing a high temperature that comes with fever, unexplained weight loss. These are signs of medical emergency. There are red flags that you have to look into and call for a medical attention. Or you're having a numbness around the back, around the anus, around, and there's a saddle area. There is lots of feeling around the buttocks, anus, and around this region, to the point that you are not even enjoying your sexual activities. These are signs that this low back pain have progressed beyond being normal, or you are also having loss of bladder sensation, you are struggling to control your urine, or you're having incontinence, or there is loss of sensation around this region. These are signs of medical emergency and have to be reported immediately. Without urgent treatment, the damage can become more permanent. So you need to rush and see a physician. You need to be rushed to medical emergency for it to be controlled. Now, this is an area of interest, the diagnosis. Okay, you have noticed these signs and symptoms that we talked about. How down do you know the type of low back pain you're having? How is it going to be diagnosed? How are you going to recover from it? This is a diagram of how it looks like when a patient with low back pain presents for medical examination. There are things that the physiotherapist or the physicians are looking out for. And that's for a diagnosis to be holistic. That's why we work in collaboration. If I assess a low back pain and is beyond my scope, I refer. The same applies to every health professional. If it is beyond your scope, you refer appropriately. And this brings about what we call diagnostic triage. When an individual presents for low back pain, we don't just assume it's just low back pain, it's just low back. It's not just until it is classified, until it is known the type of low back pain you're having. Upon examination, the first thing we are looking out for is to exclude non-spinal cause of low back pain. For instance, we'll be looking at if there is any fracture, any fall, any trauma. Is there a referral or any systemic issue? Maybe you're having a kidney challenge or you're having a prostate issue. These are the things you are first going to exclude. But if these are present, we are going to advise you further on who to go to. If you have fracture, at that moment, the fracture is still in situ. Physiotherapists cannot exclusively help you. We can only advise you to see an orthopedic surgeon, and that is where referral comes to play. So upon identification of this specific pathology, if there is fracture, if it is malignancy, if there is infection, or just that in medical emergency signs and symptoms I mentioned, upon visitation to a physician or to a physiotherapist, we refer you for this to be addressed for you to continue with active physiotherapy. Then, having ruled out the specific pathology, we'll be looking at the radicular symptoms. All right, this pain you're having, is it radiating down to the glutes, to your buttocks? Is it coming down to your thighs? Is it coming down to your calf? Is it coming down to your feet? These are evidence that there is a nerve root involvement, there is spinal stenosis. It shows that this is not just a strain, it's not just muscle spasm, it's not just trauma, there is nerve impingement. And for us to classify you, there are a lot of tests. There are certain tests that have to be done for you to be classified. If it's a nerve root involvement, there are some physical examination that the physiotherapist will carry out, okay, to check where this is actually a nerve root involvement or not. If it's a piriformis syndrome, if it's a sciatica, we'll be able to distinguish it with a diagnostic examination. Then, having ruled out a radicular symptoms and a specific spinal pathology, we'll be looking at the third triage, which is non-specific low back pain. Now, we have confirmed that you don't have any fracture, you don't have any malignancy, no infection, no caudal equina syndrome, and there is no nerve root involvement, but yet you're having pain. It shows that this is non-specific. In this non-specific condition, most times X-ray does not capture it. It is managed conservatively, starting with physiotherapy. We engage you in exercises that will benefit you, exercises that is tailored to help and address this pain. Because looking at the structures I've earlier mentioned, you understand that age and gender are important factors to consider when diagnosing how low back pain can take shape. In an elderly person, I know what I'll be looking out for. In an adult, I know what I'll be looking out for. In a young person, I know what I'll be looking out for. So that's where diagnostic triage comes in. So if you're having low back pain, it's advisable that you go for diagnosis to enable you know what type of low back pain you're having. Is it a specific one? Is it a radicular one? Or is it a non-specific low back pain? And this will bring about referral. If it is one that will involve surgery, then we'll refer you to see an orthopedic surgeon that will carry out the laminectomy, discectomy to ensure that your spine is well aligned and the impinged nerve are relieved. With that, you can progress with strengthening of your low back pain. Physiotherapy as a profession is deep-rooted in passion, dedication and drive to help individuals move, stay independent, and active after being affected by injury, illness, or disability. Because low back pain is the leading cause of disability. So physiotherapy, because during this challenge, movement is impaired. Pain can stop you from moving. It can cause you a lot of challenge and cause a lot of absenteeism at work, decrease productivity, and contribute to early retirement of some persons from their work. So the role of physiotherapy in low back pain is encompassing. In occupational aspects. The nature of your work will be looked into by an occupational therapist or occupational health physician and arrange it in such a way that you can be withdrawn from certain tasks you are performing in your work environment. Because if you continue to perform that same task, your low back pain will still persist. So we go into education and counseling to enable you understand the role of physiotherapy in managing low back pain. There are proven effective treatments recommended by World Health Organization for physiotherapists following non-surgical intervention for people experiencing low back pain. The World Health Organization are aware that low back pain is a burden and the leading cause of disability, and they have recommended a patient-centered biopsychosocial approach for managing low back pain, which physiotherapists are the ideal specialist to provide this treatment in collaboration with other healthcare professionals. And this can come in form of educational program for knowledge and self-strategy. If you're aware of how your spine works or how your spine is arranged, the structures around it, it will help you to know how to care for your back and the type of exercise that can be tailored precisely to you. A banker will have a different regimen compared to a medical professional or compared to a teacher that does a lot of standing, or an individual that is in force that does a lot of standing and walking around. So your exercise have to be tailored based on the assessment and diagnostic approach that is used. So there are physiotherapy interventions that can meet up with management of low back pain, such as manual therapy. By manual therapy here, this very spine has to be distracted. It's a technique that physiotherapists ideally employ to ensure that your spine is properly aligned and that the muscles that are strained are relaxed. Psychological therapy, such as cognitive behavioral therapy, are also inclusive because psychologically, pain can come and will interfere with your activity if your cognition is not in check. It can affect you because even when what is causing pain has gone, you may still be in trouble because of the pain you have already experienced. So psychologically, we would like to know your feeling about this pain. What do you think is the cause? Are you even aware of what is causing you the pain? So medicines such as non-steroidal anti-inflammatory drugs too can be used in collaboration with physiotherapy. And these are the approach that World Health Organization have recommended for management of low back pain. In conclusion, and we are having to take certain things home, low back pain can be experienced at any age. And at every point in life, each and every one of us will experience back pain. However, it becomes chronic for minority if not properly managed, if not that you seek attention at the right time. And you need to understand that back becomes heavier with movement and physical activity. There is a myth that don't move when you have pain, stay one place, lie down. No, there are still movements that are practical for your functionality. You have to move. All we are calling for is not to move in an abnormal way or embrace a type of forceful activity that can aggravate the pain. So physiotherapy is effective in treating and managing low back pain. There are tailored exercises that physiotherapists use for managing low back pain. It can be done while lying down, it can be done while sitting down, it can be done while standing, and a lot of postural correction and manual therapy that have to be employed. Some might be asking, can't I take drugs and my low back pain is gone? Not entirely as you think. Painkillers will not speed up recovery. Rather, with exercise, it will be able to address it. What painkiller has done is that it masks the pain, it closes the pain, and for a while you feel that the pain is no longer there, but after some time the pain occurs back. So physiotherapy does the magic by improving strength, flexibility, and mobility around that your lumbar spine, around that your low back pain. And we help individuals to regain function and reduce discomfort, enhancing their quality of life. And exercise is very, very paramount for it. A lot of stretching is what we recommend, flexibility and strengthening exercises to keep you fit and keep your back safe. Before we call it a day, there are measures I will advise you to embrace to prevent low back pain from impinging your life or from causing you disability or from leading you from chair to wheelchair or making you bed bound. First is your workstation. Are you in the sports industry? Are you in the health industry? Are you in the banking industry or in the educational industry? Your workstation has a lot of role to play in development of low back pain. If your environment is safe, your back is safe. If you employ the right posture, you are safe. Ergonomically, you have to pay attention to the nature of your workstation. Make sure it's properly arranged. Make it ideal for yourself. What is good for Mr. A may not be good for Mr. B. The nature of mattress you are using at home, the nature of cushion you are using at home, the chair you are using in your office has to be ergonomically ideal for you as a person, not as a group. You have to make it personal. It is ideal that you check your weight because your weight, when you control your weight, you have controlled a lot of factors that can impinge your health, ranging from cardiac issues to orthopedic issues. Weight control is very important. Put into consideration what you eat, put into consideration your intake and your output. Modify your lifestyle. embrace activity, embrace that lifestyle of seeking for medical attention. Your health-seeking behavior has a role to play here, and the level of physical activity you have will go a long way to helping you to manage low back pain. Low back pain is best managed on a self strategy, bringing out your whole self into consideration. And this makes a good difference. And this will help you to appreciate low back pain. Recovery is dependent on this, your preventive measure and the approach you employ. Thank you very much.
Thank you so much, PT Chimaobi. That was quite an extensive discussion you have given to this topic, and it was quite enriching. Thank you so much. Thank you so much. So very quickly, we would like to engage our facilitator on the things he has spoken about. Yes, I already have 3 questions posted here. Okay. All right. Okay. There were concerns shared. So we would like to quickly just engage and interact a little more before we call the session a wrap. So if in the course of the session you had concerns, you have clarifications to make, could you please, oh yeah, I can see a hand raised. Gerald. Okay, you have a question, please? Yes, the floor is open to you. You can come up here and just quickly share your question. Gerald, are you there? All right, so the rest of us could leave our messages on the chat box so we can raise better more quickly. We can leave our questions on the chat box, so that as we engage one after the other, we can take them. All right, thank you. Gerald, are your hands raised or you have just dropped that hand? All right, okay. All right, thank you very much. Yes, thank you, Osaro Bome. You're saying thank you for the presentation. Thank you too for being here. Okay, yes. So there's a question here, Mr. Chimaobi, on the chat box. Please, we encourage more persons to please leave their questions on the chat box. We'll take them as soon as we're done with taking this one. Okay, so there's a question here, Mr. Chimaobi. My wife, after birth, has been experiencing numbness on one side of her lap. Can this be a sign of low back pain? And what can be done to releasing this pain? PT Chimaobi.
Yes, can I have the question again?
Yes, please. So you can also read it up on your chat box. The question is, my wife after birth has been experiencing numbness on one side of her thigh. Right. Can this be a sign of low back pain? And what can be done to releasing this pain? Yeah, that's the question, sir. Thank you.
All right, great. Thank you very much. Earlier last year, toward the end of last year, we had a similar condition of a patient, a lady that just immediately after delivery, she could not stand or walk. And it didn't just start that day. During pregnancy, there is a hormone called relaxin that is released. And this hormone brings about elasticity of ligaments, tendons, and muscles that they stretch to accommodate the baby and as well make the mother a bit free. So after delivery, there is a turnover. The body has to readjust. And in the course of this, most postpartum women, most nursing mothers experience low back pain. And the best way to manage it is through physiotherapy. There are exercises, tailored exercises that will help to strengthen those regions and get them back to firmness. Also, during labor, The position or the posture that most women adopt during delivery, during labor, most of them spend hours pushing. And in the course of this, they can have what we call obstetrics palsy. There is a nerve that is impinged, and those nerves is what supplies around those regions she just mentioned. And such can be relieved with strengthening exercises, with tailored exercises and flexibility exercises that will help to bring those muscles that it supplies back to strength to enable that person move. So it's not entirely low back pain, but at that point the person is pregnant, they are at risk of low back pain. So after birth, they have a chance of developing low back pain. But if it is immediately after birth and the person is having this very challenge, it can be linked to another condition called obstetric palsy. I don't know if I made myself clear here. Can you hear me?
Yes, we can hear you. Okay. Okay, is it speaking? Someone speaking, please. Mr. Larry, are you speaking? All right, so what we can also do, Mr. Larry, if just in case you're not very clear, we can find time to visit the wellness center and ask to see PT Chimaobi, so you can just also give more understanding to the situation or the condition. I hope that's clear. All right, so we have another question here. I would quickly read off so you can attend to speak to Mr. Chimaobi. So this participant is saying she missed the part where you talked about sitting postures and angles, right? So could you speak to that again briefly? Yes, could you speak to that briefly? And also, if I can take this as a two-in-one so that you can just quickly clear up the questions currently on. What could be responsible for cramps, a cramp in the legs and numbness in the hands? Could this be as a result of back pain as well? Larry has just confirmed that what you earlier explained is clear. Thank you so much, Larry, for responding there. So, Mr. Chimaobi, I guess you got the questions they're asking clearly, so you can speak to them now. So the first one is, I missed the part where you talked about sitting postures and angles. I would like that you, okay, she would like to have the slide as well, as if you can just work us through that again, that'll be fine. And then secondly, what could be responsible for cramp in the legs and numbness in the hands? Could this be as a result of low back pains as well?
Yes, when you talk about cramp in the legs and numbness in the hand, okay, let me talk about the hand one first. Just as what is happening in the lower back goes down to the legs, what is happening in our neck also goes to the hand. And the nerves that supplies the hand is coming out from the neck. And as a result of the digital world we have found ourselves, a lot of bending of the head to press phone, to press laptop, to press tab. There is a lot of load on the cervical region, which is the neck. And this can bring about impingement of nerves that are coming out from the neck and leads to the numbness we are experiencing in the hand sometimes. It can be linked to a radicular pain that is coming down from the neck. I mean the one of the hands. So it is paramount that you do a lot of stretches, because when there is a load, an overload on the neck, the structures coming out from there are in trouble. So for one, it's more of cervical spondylosis that we call it. But the cramp in the lower legs, cramp that you are talking about, depending on the region where you are having the cramps, cramp can come in different form. If it is in the lower limb, this can be a result of most people have not been very active. And the moment they cover a long distance, they start experiencing cramp, or they start performing activity they have not been doing before, they start experiencing cramp. Cramp is not a sign of low back pain, rather is a sign of a sign of muscle, that is involuntary contraction of the muscle that occurs when one is not active enough, or you are performing an activity you have not been performing for a long time. And when you now perform it, you now end up overdoing it. And that's why we always encourage people that every exercise you have to do has to be individualized. It has to be tailored to you as a person. That Mr. A is doing morning jogging every morning to lose weight does not mean Mr. B should kill him into that pattern. There are a lot of ways to lose weight. And when it comes to this cramp, a lot of factors can cause it, which I just mentioned. It can be as a result of inactivity or physical level and fitness level. It can lead to that. Or sometimes it can also be linked to lactic acid imbalance in the body. It can provoke the muscles and they start cramping. I hope I answered this question.
Thank you so much, Mr. Chimaobi. So we're encouraging us to please show up for our monthly fitness and exercise and session that's usually organized by the Wellness Center. It's important. So after the long week of work or weeks of work, it's important that we exercise. That's something I picked out from his response to that question. Okay. Also, sir, there's another question here. A big thank you for this presentation, to Lily Hospitals Management and to you for this presentation. I'm currently suffering from LBP due to muscle spasms. I just finished my medication, and my concern is whenever I sleep, I find it difficult to get out of bed. I am not conscious of my posture when I sleep. Now, what else can be done?
Okay, before I answer this question, someone earlier asked about the sitting posture while in a working environment. Going back to the slide, you can see the correct posture in your work environment. Well, according to what is recommended, if you are in your office, your chair and your table has to be ergonomically arranged. Everything has to be at 90 degrees. Your knee, your hip, your ankle, everything has to be at 90 degrees. Then if you're working on his laptop, on his system, at least you have to be between the range of 30 degrees and 50 cm distance away from you. This is what is recommended, and the height of your chair is dependent on your personal height. It has to be within 40 to 50 cm, depending on your height. But in all situations, in any environment you find yourself and you want to sit properly, ensure that we call it ischiofemoral sitting. At least half of your thigh has to enter the chair. Half of your thigh, if you are sitting down, must enter the chair, and you sit directly 90 degrees angle at your knee, at your ankle, at your hip. And as well, your hand has to rest on the table, on the desk at 90 degrees. Anything short of this posture will bring about cramp, bring about muscle strain, bring about pain, and bring about discomfort. So this is ideal for everyone that is working in any environment. I hope I was able to answer this very part.
It's okay. It's like okay.
Yes, I'm sure you did.
Yeah, something happened.
Also to note, we would also have the slides shared and the recording. We'd also share the recording, sorry, so that people can also listen back. Yeah, Gerald, are you trying to speak? Yeah, Ibrahim. Oh, Vic. Okay. Yeah, I can see that your hands are raised. Ibrahim, can we take you firstly? You have a question? Ibrahim. Yeah, Gerald, you're going in and out.
Okay. Yeah. Good morning.
Thank you so much. Good morning, sir.
Thank you, Mr. Chinecherem, for the presentation. Though I've got it on the chat box, but my question is, you mentioned medications and NSAIDs particularly, but there are still concerns with regards to NSAIDs. So, are there exercises one can engage at home that can reduce low back pains without actually going for medication, such as you mentioned, NSAIDs that may lead to ulcer if you prolong the use of NSAID. So my question is, are there exercises one can engage in at home that wouldn't need to see a physiotherapist maybe before going to work?
Yes, Gerard. Thank you. Thank you very much, Gerard. Yes, there are a lot of exercises that can be done at home, even in your working environment. But that's why we said it's an exercise that is tailored for an individual. What I'm going to as prescribe to you, exercise I'll prescribe to you will not be what I'll prescribe for Mr. B. And that's why it's ideal you see a physiotherapist to carry out an examination. Because just as you mentioned, most NSAID they are provocative. They can lead to, if you're having ulcer, they can aggravate the ulcer. And some of them attack certain organs in our body if you are addicted to it because you want to relieve pain. So there are a lot of exercises like bridging exercise, like spinal stretch, which unfortunately I cannot demonstrate it here because it's beyond the scope of my presentation. Bridging exercises, SLR exercises, knee to chest, McKinsey exercises. There are a lot of exercises that can be done to ease your pain, and that's what we call it daily exercise, not just you do today, tomorrow, next tomorrow, you not do till next week. This is because your spine performs work on a daily basis. So they also need a daily exercise to counter the stress and strain you have accumulated over the day. So I will advise, it's ideal you see a physiotherapist that will teach you and prescribe to you personalized exercise that is paramount for your own condition. Thank you.
All right, thank you very much. I don't know if you have follow question also is within this context, within the scope of your presentation, but somebody has actually reached out to me asking about questions around um pelvic floor muscles. Some have complained of inability to last long in bed. And during my research, I found out that some Kegel exercises can actually help.
Please, can you speak out? I didn't get the question.
Okay, so I'm saying that I don't know if this question is actually within the scope of the presentation, but somebody has reached out to me asking for a particular medication that he can use to boost his sexual stamina. I don't know, being a therapist, are there exercises also that you can recommend, even though it's not within the scope, but at least to be able to give this person this information that one can engage in that can boost sexual strength?
Yes, there is always one that we normally recommend for people, and that is Kegel exercise. It can Kegel and precision exercises. There are many of Kegel exercise is not something you can just exclusively do without an instructor. You need an instructor that will guide you to perform it very well. Kegel exercise and likewise precision exercise. When it comes to sexual activity, a lot of people employ a lot of posture, which to satisfy or to get their partner fulfilled. And some of these posture can equally lead to back pain if you don't position yourself well. So when you employ the right technique, you get the right result. So there are actually exercises that can help to boost your stamina, but you also need to see not just a physiotherapist, a physician to also rule out if you have any internal issue. But if it's just only stamina that you need strength or you need, a particular boost on how to do that physically, there is exercise for it, which you can see a physiotherapist for such ideal advice.
Okay. All right. Thank you very much. That was it all. Thank you.
You're welcome.
All right, thank you so much, Mr. Chimaobi. Okay, so I can drop your hand now, Mr. Ibrahim. Vic Edelua. Yes, could you quickly ask your question? Vicky Edelua. Are you there? Vic Edelua. Vic. All right, I see that her network is not very stable. Okay, Sophia Odiano say, yes, ma'am, we can have you very quickly, please. Can you mute and then just speak? Hello, ma'am. Hello, ma'am. Okay, good. Thank you.
Hello?
Hello? Hello, ma'am. We can't hear you. Are you speaking?
Hello?
Yeah, we can hear you now.
Please,
Thank you.
can you- Hello, good morning, everybody.
Good morning to you, ma'am.
Hi. My own is just kind of contribution and question at the same time. Because we found out that in this organization where we work, a lot of persons are actually complaining about low back pain. And there was a talk by occupational health staffs last year or early this year. So a lot of persons here in Benin actually had this back pain. Same thing with worry, according to her report. And when you go around, you see that we have different kind of chairs that we actually use. There's no particular one that, no matter how you sit on that chair, no matter how the posture that you are going to take, it must give you back pain. For myself, I even have to get a pillow to support my back. The chair is the curvature, abi how we say it, and I don't know, it's not really aligning to that curvature of our back. So I don't know if those that are responsible in purchasing this chair, if they can also maybe get specification from you guys, the occupational health officers, or we can just go to the market and buy a chair. Or are you is it advisable to just go to the market and buy any kind of chair for staff to use?
Okay, let me come in here. I was part of the team, the occupational heads, when we were moving around for this very surveillance. And it will interest you to know that, yes, we have thousands of staffs working in Lily Hospital, and every day we keep getting new staffs. And it will be difficult for the organization to keep buying a particular chair for every individual that is in the organization. But the organization has structured a way to do that by getting chairs that are adjustable. These chairs are adjustable to a height and is economically arranged, although some of them may not suit your person, maybe because of the body structure. Some are mesomorph, some are endomorph, and all those things. So just as you ideally say that you're able to put a pillow, you're able to modify your own to a point that is manageable by you. Right at this moment, and what we're advocating for then is a time for you have to micropause occasionally, stand up and stretch. Because most times we are carried away by the nature of our work. Task is everywhere waiting for you, patients are right in front of you. But your head has to come into play. You have to stand up, stretch, move around the table, get back to work and sit and continue. But if you subject yourself to a particular place for a long time, no matter, just as you said, no matter how your chair, your table is arranged, you are still in trouble. So that's routine change of position and stretch is very important. So that is what we recommended. That was what we campaigned that period. In as much as the organization is making efforts to replace most of our chairs, it's also necessary that we embrace personal modification lifestyle that will also help us to avoid these inherent challenges in our working environment. Thank you.
Thank you, Mr. Chimaobi, for bringing that very important point here. It's important that in between work we stretch, we just move around. And there are several questions here, Mr. Chimaobi. I don't know how much time we have to quickly take them. There are several. We would just see. We would put them together, and maybe at one take you'll be able to respond to them. Okay. So I'll begin with this. I have. Okay. So, Sam, maybe you stretch once again on the exercises that we can do, right, to minimize or to manage this concern. Okay. Please, what about lower back pain? What about lower back pain felt mostly during standing up after sitting or sleeping for a while? By the right side of the waist. When it is intense, then that is when I start to feel it upwards down the spine. That's not very clear.
Yes, yes, it's very clear. I was about answering this question.
Okay, good.
When we are sitting down,
sorry, Mr. Chimaobi, before you move on, so you have the questions by your side. Just look through and speak to them all so that we can just take them at one time, and then we'll be good with the session. Thank you, sir.
Exactly. For the pain that you are having and you feel it when it is intense, that is when you start to feel it towards the spine. There are a lot of things I want us to understand about our body mechanism. Our body is structured in such a way that there are three activities you must carry out on a daily basis. One is lying down, one is sitting, one is standing and walking. And out of all this, the one that put pressure more on the spine is sitting. This is because when you're sitting, the upper body transfers the load to the pelvis, to the waist where we are sitting. And the tailbone, which is 5 times lower than the one at the upper backs and the neck, the causes is where we are sitting directly. So you can imagine all the structures coming from your back, passing through your spine, passing through your buttocks down to your lower limbs, and you are sitting on them for an hour, 2 hours, sometimes 3 hours, and you see yourself sitting on them. So this is enough to provoke pain. I talked about a sciatica, a nerve impingement that runs the longest part of our body, the nerve that is longest, which is sciatic nerve. It passed through our buttocks. As you're sitting down right now, you are sitting on top of this nerve. And you can testify that when you sit down for a long time, it's as if there is fire burning under your glutes, under your buttocks. You start feeling the heat, you start feeling the pressure, you start feeling uncomfortable. And that is because you are directly sitting on this nerve that is coming from the back. So you can imagine when you sit for hours and days, they become pinched, they become pressed on. And this is why when we go home, we sleep over, we roll over and come back again tomorrow to start the day. So this is enough to irritate the pain. And that's why we advocate for these daily exercises, such as bridging. Because when you are doing bridging, you are distracting the upper back and the lower back, that's the down, such that if there is anything that is trapped in between, it becomes free. Some of this is best demonstrated, is best taught by a physiotherapist. Just all you need is to take out time and request for these exercises to be taught, to be demonstrated for you, so that on a daily, after work, before going to work, you'll be able to do these stretches. You and I, anywhere you find yourself, whether in the office, some of them you can do in the office, like spinal stretch, you can do it even while sitting. So this is why you feel, and this is why we feel this. And when it starts, you start feeling it towards the spine. That's one. Then for the one that said, for the cramp, I always feel it most times when I sit for so long, especially while traveling on transit and sometimes when I'm sleeping on bed. Unfortunately, our road is not friendly enough. And moving on a public transport, you can imagine the space you have when you're on a transit in public transport, how loaded passengers are. You don't even have opportunity to stretch your leg. You don't even have opportunity to even stand up and stretch. This is actually where we have the environment we have find ourselves. And we need to advocate, we need to find a way around it, and that way is best done by you. If you're on a transit, try to find a comfortable space where you can stretch your leg. Most drivers most transport companies that we have visited yes, I have, educating them on the need of stopping by, maybe in a restaurant, an opportunity for your passengers to stretch their legs, because it's very important. So while traveling, it's ideal that if you are covering a distance of more than 1 hour, there is need for driver to stop by so that people can stretch their legs. And when you are done traveling, these daily exercises are very paramount for you to also embrace, to ease this pressure that is your spine is. I recently, in fact, he's now smiling. It's actually a testimony. This exactly what happened to this very patient. After traveling a long distance, he could not even stand, talk more of sitting. He was completely lying that he was doing. But right now he's back on his feet. So this can be as a result of entrapment. This can be a result of what? Misalignment of the spine over time. It can lead to this very condition. So we have to find a way to counter all these pressures that we're experiencing. Then this one is saying, my concern is whenever I sleep, I find it difficult to get out of bed, and I'm not conscious of my posture. When I sleep now, what else can be done? Fine. I talked about degenerative changes taking place at the spine. So during sleep, during lying, you sleep for 5 to 6 hours every day. And at that point, there is no movement taking place in your spine. So immediately you get up, everywhere seems to be locked up. But when you start moving around, they start unlocking. So these are early signs of arthritis at the spine, at the back. So what you have to do in this aspect is to increase the movement applicable at that region of your spine. When you get up, don't feel discouraged. You have to carry out this minor stretch exercises while you're on the bed before you start moving around to ease and grease those regions of the spine that is becoming stiff. So there are a lot to talk about in this respect, but I can advise that we maintain this tempo and continue to encourage each and everyone to see a physiotherapist who will equally refer you to an orthopedic surgeon if your case is beyond active physiotherapy. Let's say there is a fracture, there is a disc herniation, or there is a bulging disc that needs to be properly aligned, then this calls for it. But at the meantime, in all situations, even after surgery, you still need these exercises to keep your spine strong. Thank you.
so much. So I believe we've been able to cover all the questions that has been put here. My question is yet to be answered. Emmanuel is still saying, my question is yet to be answered. Let's look out for his question. Okay, so he was saying, I'm suffering from LBP due to muscle spasms. I just finished my medication. My concern is whenever I sleep, I find it difficult to get out of bed. I am now conscious of my posture when I sleep now. What else can be done, sir? What else?
I just answered it now. Yeah,
Okay.
I just answered it now. I said that if you're finding it difficult to get out of bed, these are early signs of arthritis at the low back. Okay? And it's as a result of time we have spent on not moving. So it's a warning sign. Even sometimes X-ray cannot capture this. If you go for X-ray, X-ray will not capture this. But these are signs. So what is needed is to increase movement applicable at that region. Okay, do a lot of stretches that will help to open up those spinal spaces so that you can be able to move and roll in bed. And possibly you see a physiotherapist so that we can investigate this further and just be sure that it is just only a spasm, as you said. You can rule out other things by carrying out a physical examination.
Very much, sir. Thank you. We'll also be sharing with us the recording so we can have the time to listen up again and then get acquainted with the very important points that has been talked about here. Okay. I'll see the hand raised here, but I can't see that anymore. I hope that we're fine so far. Yes, in the absence of no other question, which I can't find here, I can't see any new question posted here. Mr. Chimaobi, we want to thank you for your time with us this morning. It was quite an extensive one, and you were just patiently taking us through the discussion. We want to thank you so much, and everyone who has participated in the session today, we're saying thank you. We appreciate your time and engagement in this very important discussion. And as promised, we will be sharing the recording of the session with everyone so we can revisit the insights and then the strategies that has been discussed. All right. Also, more sessions, more webinar sessions will be coming up from here. We want to encourage that you look out for the updates, the posts, and then join us anytime we are putting on the session. Once again, we want to say thank you. Remember, our wellness center are always engaging us on at the end of the month, last Saturday of the month, every month, exercises, and whether you want to join us to also do well to make our time to join in for such session. Once again, want to say thank you for everyone. Please look out for the recording so we can listen up again and then do well too.
All right. Before we call it a day.
Yes. Yes, sir. Yes.
Can you hear me? Before we call I also make it clear to everyone that you can free to visit our Lady Wellness Center here in Jeko Road, Warri, or also in Benin, number 3 Avenue at off Ikpupan branch of Ikpupan, and you will be privileged to see a physiotherapist that will engage you properly in the management of this low back pain. And we are readily available to give you the best form of advice. And aside from low back pain, there are other conditions like stroke, arthritis, even children with delayed developmental milestone, elderly people that have Parkinsonism, have heart-related or respiratory challenge. We offer all these services. And in any of these branch, you are always free to call for our services. Thank you very much.
PT Chimaobi, I want to wish us all a very beautiful day. The audio link, as promised, will be shared with us. Our wellness center is open to us 24/7. Please reach out to them for any concern around what we have talked about. Refer clients who are experiencing this kind of concern, and we'll be glad you did. Do have a great day
Yeah,
still, everyone.
more
Yes.
still,
Yes, sir.
please. I'll still be on air at Mega Station on the 12th of September to take this discussion further in case of anyone that's still need clarification on some of these things we have handled here. And even today by 1 p.m., I'll still be in Rise FM, Guest FM to look more into this on the 13th and on the 12th, respectively, Mega Radio Station and Guest FM, really for more exposition on this topic. So you can still join us and ask more of your questions. Thank you very much.
Thank you so much, Mr. Chimaobi. I think we can call it a day from
Yes,
here.
of course.
Thank you all. Do have a great day still. Bye for now. Thank you.
Bye.